What's up, hoopers? As a hooper, and many of you that are watching this video, you have probably rolled your ankle before. If you haven't, I hope that you never have one, but unfortunately in basketball that is one of the most common injuries, so knock on wood, that never happens to you. But with that being said, have you ever considered what actually is injured when you roll your ankle? Have you considered thinking about, like, should I get an x-ray or not? How long am I going to be out for? What does kind of the treatment look like? In this video, we're going to go over the basic anatomy of the ankle. We're going to go over the factors that you should consider whether or not you should get an x-ray. And then we are also going to go over the grades of severity of ankle sprains, kind of like the timetable to expect, and other things that you might want to consider when you have an ankle sprain, like signs and symptoms. So keep watching and stay tuned. What's up, hoopers? My name is Dr. Gabe Ignacio, Doctor of Physical Therapy, Orthopedic Clinical Specialist, and co-founder of the Basketball Doctors, alongside with Dr. Marco Lopez. If this is the first time you're listening to us, please subscribe to our YouTube channel and hit the notification bell so that every time we release a video, you're updated with what's going on. Basic Anatomy 101 for the ankle joint itself. So we have the ankle here. This one's the left one, so looking at the outside part of it. So let's go over the bones first. So the small one here is your fibula, or the outside bone, and the bottom portion of your tibia. The tibia and fibula attach to or get connected to your talus here. So it's kind of the bottom part of your foot itself. And then right back here is the big heel bone, or the calcaneus. So there's other muscles and bones that come further down here, but we're gonna focus more on this part of the ankle joint itself. Main ligaments, the outside ligaments here, or the lateral part, are the ligaments that tend to get hurt and injured when we have that rolled ankle or ankle sprain. So it's called lateral ankle sprain because of the ligaments that come to the side here. So there's three main ones. So the first one's your anterior talofibular ligament. So anterior, so on this front side part, talofibular, so kind of where it connects to. So the talus that we talked about earlier, and then the fibula. So it's like a little band that goes right there. The second one is your calcaneofibular. So again, based on what its attachment sites are. So calcaneus, like we said, was that heel bone. So this one here, and then the fibula, and it comes straight down that way. And then the last one is the posterior talofibular ligament. Again, based on attachment, calcaneus to fibula on this backside. So that's the basic anatomy of the outside ligaments. There's also a lot of tendons and muscles that run through this area. One that gets commonly injured and strained at the same time is your peroneal muscle group, or your fibularis, depending on who you talk to. So it pretty much attaches onto your fibula, or this outside part of your ankle, and the tendons come down and attach to your foot down below, so those tendons can get overstretched. There's also other muscles that need to be considered. Because of the injury itself, you might have some disuse and atrophy or weakness of, like, your calf muscles, your Achilles tendon as well, your post-tibialis muscle, and then your glutes and other muscles up the chain. And the last thing to consider is the joint mobility and joint. So there's two main joints that we'll focus on in this video. One is called your talocrural joint. So it's the one in the front here. That's the main attachment, and it pretty much moves your ankle up and down. So up meaning dorsiflexion, down meaning plantar flexion. And the other main joint is called your subtalar joint. And that one's pretty much when your ankle moves in and out, in meaning inversion, out meaning eversion. Remember those terms because that's going to be important when we go over the mechanism of injury for lateral ankle sprains. So let's talk about the mechanism of injury, or MOI, of how ankle sprains happen. Typically when someone lands and their foot goes into inversion, typically with some type of plantar flexion or dorsiflexion. And it happens the most in basketball when you're landing or cutting or decelerating. Especially you see it a lot when people land on someone else's foot when they come down for a rebound or driving into the paint. So that's typically the most common mechanism of injury. When it's non-contact, it's just the same aspect where they just don't land on someone's foot, or they're not contacting the air, where the foot just naturally turns over and you roll your ankle. With that being said, of that ankle going into inversion and the contact and non-contact, so the most commonly injured lateral ligament is your ATFL, so that anterior talofibular ligament here, and that typically happens when your ankle is inverted and slightly plantar flexed. So if you can imagine when someone's coming down for a rebound, They usually come down like so, and then someone's foot's right there, and then they roll that way. That one's typically the most common, the anterior talofibular ligament. Next, most common is the calcaneofibular ligament. That one typically happens when it's straight inversion, but typically the anterior talofibular ligament will also be damaged alongside with the calcaneofibular ligament. And the least common ligament injury is that posterior one, because the way that one gets injured is when you also invert, but the ankle also is in some dorsiflexion. So you don't see this as often, and it's very hard to tear that ligament, but it does happen in the rare cases. Sometimes it's a more severe ankle injury because the way to get to that posterior one is when you go through the other two. All right, now the question is, should I get an x-ray after I roll my ankle? So there's a study that came out a while back. A lot of healthcare professionals use this to consider if you should get an x-ray or not, if you are concerned and want to get an x-ray. So first is, are you able to take 4 steps immediately after the injury or some point after that? I know it's very tender and you might be limping, but if you can weight bear through that foot for 4 steps in a row, it's considered that you don't need to have that x-ray. Other things to consider is if you're tender at your lateral malleolus, 6 centimeters above and below. So lateral malleolus is pretty much the bottom portion of your fibula, so this little pointy thing here, 6 centimeters above, and just kind of palpate. If you have sharp pains, if you say yes to that, consider to get an x-ray. Also at your medial malleolus, again, medial malleolus is this bottom portion of your tibia, kind of another bony prominence that you see on your foot and ankle. Again, 6 centimeters above, palpate down. If it's sharp pains, consider having an x-ray. Other portions is the base of your 5th metatarsal, so your pinky toe, kind of all the way towards the back end where that little bony prominence is. If that's tender at that area and might have some sharp pains, consider having an x-ray. Another one is your navicular bone, so on the inside part. It's kind of hard to palpate on yourself if you're not familiar with anatomy, but your navicular bone, you could Google it. We'll also show you a picture here, but right here, if that's tender and sharp, consider having an x-ray. So there's those portions that they say, if you say yes to any of those that I just said, consider having an x-ray to rule out a fracture. So when you roll your ankle, some very common signs and symptoms that you'll see is pain and swelling, specifically around that lateral ankle. You might see some ecchymosis or bruising, some like discoloration around that lateral ankle. You guys have seen it before, that ankle just looks super puffed up. It looks like there's like a golf ball or like a baseball in there. You guys kind of know what it looks like. Another one is tenderness right on those specific ligaments. Obviously a healthcare professional would be better at kind of palpating those different areas, and you might have some tenderness on the medial side, on the back side of your ankle, up top higher. Like I said, there's a lot of things that happen when that ankle rolls, so it's usually just not just the ligaments that get injured. There's a lot of things that you need to consider as well. Let's go over the grades of ligament injury that occurs with the lateral ankle sprain. There's 3, 1 through 3, 1 being the least severe. So let's go over grade 1 first. So grade 1 is there's actual damage and issues with the ligament itself, but there's no detectable change in the ligament. So there are clinical tests that we use as physical therapists to assess the laxity of the ligament. So with that being said, there isn't much laxity. We can't really detect it clinically, but like I said, there is some structural damage to the ligaments, just not enough. And you might notice that your function is relatively high. You're walking pain-free, maybe like a little bit of tenderness, but you're doing pretty well. The loss of range of motion is less than 5 degrees. So range of motion that we're most concerned about is dorsiflexion and plantar flexion. And then there might be like mild swelling. Typically at this grade is less than 0.5 centimeters or half a centimeter. Grade 2, there is more change and damage to the ligament itself, so that now we couldn't detect that with our clinical measurements. Now there is. So as we do our test, we notice moderate ligament laxity. And you might notice too that there's some loss in your function. So like walking is more challenging, doing everyday things, rather it being like, oh, I could get through this, it's more like cumbersome, you're having a little bit of pain. You just notice that things are more challenging. The total loss of range of motion is somewhere between 5 to 10 degrees into that dorsiflexion, plantar flexion. There's a little bit more swelling, so about 1/2 centimeter to 2 centimeters. And you might notice that bruising and swelling a lot more than what you did in that grade 1. Grade 3 is a complete or near complete tear of the ligament. And this is where you'll notice your function is severely hindered, where walking is very painful, it's hard to do everyday things. You might rely on crutches, a brace, a boot, something to get you to function. You might even be on crutches just to get you to function every day. There's a lot more range of motion loss, usually greater than 10 degrees. The swelling is a lot bigger, so we're expecting greater than 2 centimeters of swelling. So those are the 3 different grades. The good news is that like 85% of lateral ankle sprains are between that grade 1 and 2. So grade 3 has to be pretty severe. Unfortunately, it happens, but that's where you have your clinical test and your medical team around you to help make sure you're going down the right path. So now the question becomes, I had my ankle sprain, how long will I be out for? So it depends. Obviously, one on the grade of the injury and kind of your timetable with your specific intensity level and your level of play. But generally speaking, grade 1s have the quickest recovery. You'll see a good amount of recovery and healing and return to sport, usually in that 4 to 6 week mark with the proper ramp up. Grade 2 and 3 are challenging. It's hard to give you a direct time frame on when you'll return, but it takes a lot longer than people expect. Obviously, you can start ramping up your activity and get back into play, but based on tissue healing, this is what you need to know. So you'll see a rapid recovery in those first 14 days. So getting that range of motion back, decreasing swelling, decreasing pain, improving function happens rapidly in those first 14 days. After that, it's kind of like a longer recovery. You really have to make sure you're under the right guidance with either physical therapy, athletic trainer, a medical doctor, someone who is in your team that can take care of you. Make sure you do it the right way. But typically you'll see a lot of improvement in that ligament strength up to 3 months. And typically around that 3-month mark, the ligament is about 80% of its strength. So again, those timeframes information was based off of tissue healing properties. But now we're gonna go over like what to expect besides the tissue healing. So 5 to 33% of individuals report pain up to 1 year after their injury. And then 5 to 25% report that they still have pain up to 3 years after the injury. Another big thing that people report that they have issues with moving forward that tend to linger is pain, instability, stiffness, swelling, and weakness. So there's still residual factors that are there. Good news is that 50 to 85% people report that they have a full recovery by 3 years. But a big issue that we're seeing is that only 55% of people search for medical help after an injury. And when people don't do that, they tend to have these lingering issues for way longer than they need to be. And that's where we really advise people to seek medical advice. Reach out to us, reach out to a medical professional to help you rehab properly, so that 1, you can prevent injuries, and 2, perform better at your best when you don't have to deal with these lingering issues of instability, weakness, pain, lack of range of motion. You're just setting yourself up for potential issues that are bigger than a lateral ankle sprain. So reach out, get this taken care of. It happens a lot, but it can be very easily addressed with some exercise and proper guidance. So if you're concerned about having a lateral ankle sprain, here are some risk factors that we found through research. So first, basketball athletes who have sustained a previous ankle sprain before are actually 4.9 times more likely to sustain another ankle sprain injury. Another statistic is that basketball athletes who do not stretch are 2.7 times more likely to sprain their ankle. And then another one, kind of what we talked about with range of motion, is that we have this test that we like using to assess ankle dorsiflexion range of motion. It's called the anterior reach. If you have a difference of 2.5 centimeters in comparison to the other side, you are 4 times more likely to sustain an ankle injury on that side that lacks that range of motion. Alright guys, so let's quickly summarize what we talked about in this video. So lateral ankle sprains are the most common injury in basketball. The anterior talofibular ligament is the most common one that gets injured, and it typically happens when the ankle goes into inversion. There's 3 different grades of injury, grade 1 being minimal to no damage, and the most severe being that grade 3. Predict your time frame based on tissue healing. Like I said, there are some long lingering issues that happen up to 3 years after an injury. And like I said, only 55% of athletes search for help. So really make sure you're taking care of your body and making sure you're doing the right things to make yourself perform better and prevent injuries. It's very easy to take care of, and making sure you don't run into issues that can cause a more severe injury. To help you guys out, we came out with an ankle program that just got released. So click the link in our bio to check that out, or reach out to us. We do some online consultations and in person as well. So email us if you have any questions. We're here to help. Comment below. If you guys like this video and you found it super helpful, please do us a favor and help us out by trying to reach more hoopers and get our name out there by liking, subscribing, commenting, and sharing with friends or family. If you didn't like the video, please comment below or email us on how we can improve our delivery and improve our content. We're here to help. Again, we are the Basketball Doctors. Let's ball for life.